guys, it's Leah Buckles from Prestige Worldwide Medical Consulting. I am a U.S. Army veteran, physician assistant, and former CMP examiner. So today I wanted to come on and discuss GERD or gastroesophageal reflux disease as it relates to PTSD and other mental health conditions. So what is GERD? So GERD or gastroesophageal reflux disease is a condition in which your esophageal sphincter does not function correctly, and you may have acid contents from your stomach, reflux, or travel back up in the wrong direction and cause you symptoms that can include heartburn, coughing, shoulder, chest pain, nausea, vomiting, difficulty breathing, coughing, stomach aches, things like that. It doesn't have to include all of those, and just because you have those doesn't mean it's due to GERD, but some of those are some of the symptoms that people can describe while they're experiencing that. So how can GERD be related to your service? So several ways. So if a person is diagnosed in service and they're treated, maybe they're treated with Prilosec or ranitidine or some kind of condition on active duty, and it continues after they leave service, it may be something that can be easily service connected, right? That doesn't mean it will, but if you can show that you've developed the condition on active duty and it has continued after separation, that should be something that's pretty reasonable to show that's related to your service or incurred in the line of duty. Now, if it is on a secondary basis, I see several different conditions that can cause or aggravate or worsen the condition, right? And we've done several videos on this in the past. You can go take a look at them if you'd like. We've done videos on it as it relates to anti-inflammatory use. We've done videos on, what to expect in a GERD CMP exam, things like that. I hope you found them helpful. As it relates to mental health disorders, there's a lot of information that's out there that I hope you can find useful. You can take to your private treating doctor, your gastroenterologist, your primary care doctor, the VA, or whoever. And I'd like to share some of those articles with you guys today so that you can kind of go take a look at them and see if it's a discussion you may want to have with them about do they think that this is related to your mental health disorder? Now, there can be other causes, right? They have to rule out and look at as well. But when it relates to PTSD, one of the articles that I like to discuss is Measuring the Effects of Emotions on Esophageal Motility, published in Psychosomatic Medicine. It studied the relationship between emotional state and esophageal motor function. It did so by recording esophageal motility during unstructured psychiatric interviews, and it showed a significant relationship between effectively charged material and non-propulsive activity in the esophagus. And was found consistently in about 40% of the subjects. Another article, Non-Propulsive Esophageal Contractions and Gastroesophageal Reflux, published in the American Journal of Gastroenterology, is another article that I like to use. The Journal of Gastroenterology and Hepatology published a study called The Association Between Gastroesophageal Reflux Disease with Sleep Quality, Depression, and Anxiety. And there's several more that I could go on to discuss. But essentially, there's definitely a lot of evidence that supports a relationship there. Let me see if I can give you guys one more. Stressful psychological factors and symptoms of gastroesophageal reflux disease, a population-based study in Norway, published in the Scandinavian Journal of Gastroenterology, is another article. So let's talk about ratings. A lot of veterans like to talk about ratings. So I'm not an accredited claims agent or a VSO attorney, legal expert, etc. I just review files and provide technical reports on the files that I review. But a lot of times veterans like to ask about GERD ratings, right? So I just like to briefly touch on those, and these are always subject to change. So you may want to discuss that with whoever's representing you legally to make sure, to get clarification on what the current ratings are. So for a 10% rating, a veteran must present with 2 or more symptoms of the 30% evaluation of less severity. So what are those, right? So a 30% rating requires persistently recurrent epigastric distress with dysphagia, pyrosis, and regurgitation accompanied by substernal or arm and shoulder pain productive of considerable impairment of health. A 60% rating requires symptoms of pain, vomiting, material weight loss, and basically spitting up or throwing up blood, or melena, which is blood in your stool, with moderate anemia or other symptom combinations productive of severe impairment of health. So another question I get asked a lot, and I've touched on this before, is can a person be rated for GERD and IBS at the same time? Well, generally, I don't think that they're rated separately. That doesn't mean they never can be. I think you have to show how. I've never seen them rated separately. Let's say most often they're intertwined due to something called pyramiding or overlap of symptoms. So you may have a rating that says GERD with IBS, and then they're going to provide the higher rating, right? So if you meet the 30% criteria for IBS, 60% for GERD, you're probably going to have 60% overall for that combined criteria. Now, that's not to say always and never, because there's always, every case is different. So again, you want to follow up with your legal representative on that for further clarification. Okay. So I hope this discussion on GERD as it relates to PTSD has been helpful. I hope you guys found some of those studies helpful. If you guys have any questions, please drop them in the comments below. If you have any feedback, I'm always happy to hear that as well. Please like and subscribe to this channel. We're trying to grow it. And if you have any other topics you'd like to hear about, I'm always looking for new topics so that we can keep things moving along. So thanks for watching, and talk to you guys soon. Bye.